So weight loss drugs, you probably know them as semaglutide, tirzepatide, Ozempic, Wegovy, or by the generic term, which is just GLP-1. But did you know there's another contender? And this one happens to come in the form of a pill. And it did almost as well as semaglutide did in clinical trials. And it did it in a fraction of the time. But I'll also bet you've never heard of it. So it's called tesofensine, and I take it myself. Now, I'm not trashing semaglutide or tirzepatide. In fact, my clinic, we prescribe both of these. And I personally take retatrutide. My point is I am very much pro GLP-1. But you can't make an informed decision if the only options you have are those with billion-dollar advertising budgets. So let's start this educational process by understanding how these different medications work in your body. GLP-1s work in your gut. They mimic a hormone that tells your brain, I'm full, stop eating. And they also empty your stomach more slowly, so you feel full a lot longer. It's extremely effective. Tesofensine, on the other hand, has a completely different mechanism. It works exclusively in your brain. You know that little voice inside your head, the one that's always thinking about food? And I'm not talking about real hunger. This is more like background noise. It's that little voice inside your head that right after breakfast says, what's for lunch? Or wait a minute, was that pie on the counter? That's called food noise. And for many people, it never shuts off. So tesofensine gets that voice to play the quiet game. And it keeps three of your feel-good brain chemicals, dopamine, norepinephrine, and serotonin. It keeps those active longer in that part of your brain that controls appetite. So your brain just stops obsessing about food. So quick recap. GLP-1s make your stomach feel full. Tesofensine makes your brain stop bugging the shit out of you until you bring it pie. Different tools, different problems. Now here's how effective each one of those medications was according to their trial data. With tesofensine, there was a 12.8% body weight reduction over the course of 24 weeks, which is roughly 6 months. Semaglutide was around 15%, but that took 68 weeks, which is almost a year and a half. And tirzepatide came in at 20% and retatrutide at 24%. And both of those were over a 48-week period of time. So if tesofensine is so good, why haven't you heard of it? Because it was developed by a small Danish company, and they were actually studying it for Parkinson. And all of a sudden, they see their patients losing all this weight. So they pivot, they go to obesity research, and phase 2 trials, they were impressive. Then nothing, no phase 3, no FDA submission. And it wasn't that it didn't work, just nobody had the billions of dollars it takes to push it through the system. And that's the real truth about modern medicine. What you hear about isn't always what works best. It's what's most profitable to market. But here's the reason I made this video. Since tesofensine and GLP-1s work through completely different pathways, you can take them together. And that combination, that's next level. The GLP-1 handles the physical side, appetite suppression through the gut, slower digestion, blood sugar control, and tesofensine handles the mental side. So that constant food noise, now, as I've said, I take both. And the difference between a GLP-1 alone and a GLP-1 plus tesofensine, it's pretty substantial. But let's not forget about the list of potential side effects. Tesofensine can raise your heart rate. Some people get insomnia or dry mouth. And if you're sensitive to stimulants, you might get jittery or anxious. But if you encounter any of these side effects, you might just need a lower dose. Now, I've never seen any of these negative side effects. But then again, the medical providers at my clinic, Viking, understand these compounds and how they interact with each other. So if you want to know more, and you're a patient at Viking, or if you just want to be a patient at Viking, this is a conversation definitely worth having, because getting old is inevitable, but settling for whatever drug has the biggest marketing budget, that's a choice.